Which type of signaling is shown in the figure? Auto-tune, paracrine, merocrine, endocrine. One more option can be autocrine, not auto-tune. Autocrine, okay? Now, what is your answer? You can see here, this cell is releasing something, and the paracrine factor is that it is stimulating other cell. So whenever one cell releases a chemical, a ligand, which is activating other cell, it is called as paracrine. Paracrine. One example can be interleukin 1. If you remember the immunity, okay, if you remember the immunity, macrophages are releasing interleukin 1 to activate T lymphocytes. And if you remember T lymphocytes, they release interleukin 2 and they stimulate their own cell. It is called as autocrine. So when one cell is releasing some chemical or the ligand or the hormone or neurotransmitter, whatever, and stimulating its own cell, it is called as autocrine. When some other cell, it is called as paracrine. What about endocrine? When they release certain substance in the blood, and in the blood they will go to distant circulation and they start activating distant organ or the tissue, then it is called as endocrine. So autocrine, paracrine, and endocrine. So these are the terms which you need to understand. So this question is regarding, answer will be B, paracrine stimulation. Which of the following will cause a decrease in extracellular potassium? I mean hypokalemia. Hypokalemia can be caused by lactic acidic, metabolic acidosis, epinephrine, glucagon, or atropine. What is your answer, doctor? These are often repeated topics in your exam, like hypokalemia, hyperkalemia. They keep on asking important points regarding hypo and hyper. Sometimes they will ask you about the ECG changes. Sometimes they will ask you about the management. Sometimes they will ask you about the cause. Okay, so hypokalemia, ECG change. ECG changes are, the mnemonic is stupor T. The mnemonic to remember hypokalemia changes is stupor key. ST depression, U wave, PR will decrease and T wave will be inverted. T wave will be inverted. Okay. And regarding hyperkalemia, okay, the EC changes are, remember, write down P, Q, R, S, T. P wave will be absent. QRS will be wide. And T wave will become tall and tented. Tall and tented.